Shall I start, sir? Good morning. I am Dr. Maunika. Today my case presentation is on blinded by nature and neglect, a case study on toxic keratitis. Coming to introduction, toxic keratopathy is defined as a corneal pathological changes or a functional disturbance with or without any inflammatory response caused by accidental exposure to topical or systemic medication and associated preservatives or breakdown products of the drug. Due to its potential sight-threatening nature, toxic keratitis must be recognized and managed correctly. So, a retrospective observational study was done in 48 patients with toxic keratitis over a period of 6 months, of them male being 32 and female 16. Age group, they presented from 16 to 60 years, and presentation to the hospital was within 6 to 48 hours. Occupation, most of the patients were farmers, flower vendors, household work and students. Activity at the time of injury, plucking flowers, gardening work, applying henna, custard apple seed powder to the hair. Coming to etiology, 37% of the patient had accidental exposure to plant sap, 27% has accidental exposure to calotropis juice, and rest 10% to custard apple seed powder, and 13% were with henna and topical drug abuse. So these are the different presentations. Patient presented with punctate epithelial erosions, epithelial defects, corneal edema with Desmond folds, and reactionary hypopyon and corneal infiltrate. So most of the patients, like 70% of the patients presented with punctate epithelial erosions and 44% with epithelial defect. Rest presented with corneal edema, Desmond membrane folds, hypopyon, pseudodendrites, iridocyclitis, and only one patient presented with severe corneal infiltrate. So we have treated the patients accordingly. Patient who presented with punctate epithelial erosions and epithelial defect, hourly topical lubricants and 0.5% moxifloxacin eye drops 4 times per day given for 3 days and reviewed again. Patient who presented with Desmond membrane folds and corneal edema, a combination of antibiotic and steroid eye drops of 0.3% gatifloxacin and 0.1% prednisolone 6 times per day, along with a cycloplegic 0.1% homemade eye drops BD were given. Patient who presented with reactionary hypopyon and keratic precipitates, a combination of antibiotic steroid eye drops 2 hourly for 3 doses, then with tapering doses, along with that cycloplegics and anti-glaucoma medication BD were given for 1 week. Patient who presented with an infiltrate, after performing the necessary investigation, we have started the patient on fortified cefazolin 5% eye drops hourly for 2 weeks, then 8 times per day for 2 weeks, along with that 5% natamycin eye drops hourly for 2 weeks, then 6 times per day for 2 weeks, along with that cycloplegics and anti-glaucoma medications were given. One patient presented with pseudodendrite. We started the patient on 0.5% moxifloxacin eye drops hourly for 2 weeks, then 8 times per day for 2 weeks, along with topical lubricants hourly, followed by cycloplegics. So results, patients were followed up on day 1, 3, first week, second week and 1 month. Most of the patient gained visual potential within 2 weeks. Patient with corneal infiltrate and hypopyon recovered within 1 month. So these are my results. Most of the patients visual acuity ranged from 6.9 to CF 1 meter. Most of the patient gained visual acuity within 2 weeks. The patient who presented with poor visual acuity at presentation was the last one to recover. All the eye signs and symptoms got recovered within 2 weeks. The patient who presented with infiltrate was the last person to heal, which took us 1 month. So this is an interesting case. A 32-year-old female presented with accidental exposure to custard apple seed powder. While on presentation to the hospital, we have noticed a 7 mm infiltrate. After doing the KOH mount and gram stain, in gram stain we have ruled out Staphylococcus aureus. So we started the patient on topical cefazolin 5% hourly and topical 2% atropine eye drops, and oral analgesic were given. Post-op, like day 30, patient healed with scar. Coming to discussion. So plant sap, it is usually toxic to the epithelium due to its acute acid injury, and it also produces contact dermatitis. Calotropis is of again 2 types. It may be Calotropis procera gigantina. Most of the time, calotropis juice is non-toxic to the epithelium and toxic to the endothelium. The latex which is present in the calotropis leads to release of histamines, which in turn activates the inflammatory cascade, leading to Desmond membrane folds and stromal edema. We have performed a specular microscopy in patients who presented with accidental exposure to calotropis juice. There is a significant polymecathism and pleomorphism. After day 30, we have again taken the specular microscopy where the results were good and the polymecathism was not observed. Patient who presented with tropical drug abuse, usually there will be a disruption of intercellular spaces and decrease in microvilli and prominence of cell nucleus, which leads to disruption of epithelium and leads to punctate epithelial erosions and epithelial defects. And seeds of Ananas squamosa, also called custard apple seed powder, contain active components such as alkaloids, cyclohexapeptidates, and acetinogens, which are toxic to the epithelium. So my conclusion, misdiagnosis of toxic keratitis is sustained or increased use of medication leads to vicious cycle that can potentially threaten the vision. So my study emphasizes that need for the patient and clinician education for prevention and management of lesser known toxins to prevent ocular morbidity. These are my references.